Fentanyl is a powerful synthetic opioid that has become a significant contributor to the opioid crisis in many parts of the world. Initially developed for pain management in cancer patients, its potent effects and high potential for misuse have led to widespread public health concerns. Fentanyl poisoning, often resulting from unintentional exposure or overdose, is a critical issue that demands thorough understanding and proactive measures. This video summary delves into the nature of fentanyl, its uses, the scope of the fentanyl crisis, symptoms and effects of poisoning, treatment options, prevention strategies, and ongoing efforts to combat this public health emergency. Nature and uses of fentanyl. What is fentanyl? Fentanyl is a synthetic opioid analgesic, estimated to be 50 to 100 times more potent than morphine and about 50 times more potent than heroin. It was first synthesized in the 1960s and is used in medical settings for managing severe pain, particularly in cancer patients or individuals undergoing surgery. Its rapid onset and short duration of action make it a valuable tool in pain management, but these same characteristics also contribute to its high potential for abuse and overdose. Medical uses of fentanyl. In medicine, fentanyl is administered in several forms, including intravenous, often used in surgical settings for anesthesia. Transdermal patches, provide continuous pain relief over several days. Lozenges or lollipops, designed for rapid pain relief in cancer patients. Nasal sprays and tablets, used for breakthrough pain in patients already on opioid therapy. Illicit use in manufacturing. While pharmaceutical fentanyl is strictly regulated, illicitly manufactured fentanyl, IMF, has proliferated in illegal drug markets. This illicit fentanyl is often mixed with other substances, such as heroin or cocaine, sometimes without the user's knowledge, significantly increasing the risk of overdose and poisoning. The scope of the fentanyl crisis. Epidemiology. The rise of fentanyl-related deaths has been alarming. According to the Centers for Disease Control and Prevention, CDC, synthetic opioids, primarily fentanyl, were involved in nearly 70% of opioid overdose deaths in the United States in recent years. The rapid increase in deaths is attributed to the potency of fentanyl and its presence in the illicit drug supply. Fentanyl analogs. Beyond fentanyl itself, numerous analogs have been developed, some of which are even more potent and dangerous. These include carfentanil, which is used as an elephant tranquilizer and is estimated to be 100 times more potent than fentanyl. These analogs add complexity to the overdose crisis and challenge law enforcement and public health efforts. Routes of exposure. Fentanyl poisoning can occur through various routes, including ingestion, swallowing the drug, either intentionally or unintentionally. Inhalation, breathing in powdered fentanyl or its analogs. Injection, directly injecting the substance into the bloodstream. Dermal contact, absorption through the skin, though this is less common and usually involves large amounts of fentanyl. Symptoms and effects of fentanyl poisoning. Acute symptoms. The symptoms of fentanyl poisoning are primarily related to its effects on the central nervous system and respiratory system. They include severe drowsiness, extreme sedation or an inability to stay awake. Respiratory depression, slow, shallow, or labored breathing, which can lead to respiratory arrest. Miosis, pinpoint pupils, a common sign of opioid overdose. Cyanosis, blue-tinged skin, especially around the lips and fingertips, indicating a lack of oxygen. Loss of consciousness, unresponsiveness or inability to wake up. Chronic effects. Chronic exposure or misuse of fentanyl can lead to a range of health problems, including tolerance and dependence, needing higher doses to achieve the same effect and experiencing withdrawal symptoms without the drug. Organ damage. Long-term use can damage organs such as the liver and kidneys. Cognitive impairment, memory problems, difficulty concentrating, and other cognitive deficits. Mental health issues, increased risk of depression, anxiety, and other mental health disorders. Diagnosis of fentanyl poisoning. Diagnosing fentanyl poisoning involves a combination of clinical assessment and laboratory testing. Given the rapid onset of symptoms and the high risk of fatal overdose, timely diagnosis is critical. Clinical assessment. Healthcare providers assess for signs and symptoms of opioid toxicity, such as respiratory depression, altered mental status, and meiosis. A thorough patient history, including potential exposure to fentanyl, is also crucial. Laboratory testing. Laboratory tests can confirm the presence of fentanyl or its metabolites in the body. Common methods include: urine drug screening detects the presence of fentanyl and other opioids. Blood tests measure fentanyl levels in the bloodstream, though these are less commonly used due to the need for specialized equipment and longer processing times. Treatment of fentanyl poisoning. Emergency response. Immediate treatment is essential for fentanyl poisoning. Key steps include: call emergency services. If fentanyl poisoning is suspected, calling emergency services immediately is crucial. Administer naloxone. Naloxone, Narcan, is an opioid antagonist that can rapidly reverse the effects of fentanyl. It is available in intranasal sprays and injectable forms and can be administered by first responders, healthcare providers, or even bystanders. Supportive care. Supportive care in a medical setting is often necessary, including respiratory support. Mechanical ventilation may be required in severe cases of respiratory depression. For fluids, to maintain hydration and support blood pressure. Monitoring, continuous monitoring of vital signs and oxygen levels. Long-term management. For individuals who survive fentanyl poisoning, long-term management may include detoxification, medically supervised detox to manage withdrawal symptoms. Medication-assisted treatment, MAT, medications such as methadone, buprenorphine, or extended-release naltrexone to reduce cravings and prevent relapse. Therapy and counseling, behavioral therapies, including cognitive behavioral therapy, CBT, and contingency management, to address underlying issues and develop coping strategies. Prevention strategies. Preventing fentanyl poisoning involves a multifaceted approach, including public education, policy measures, and harm reduction strategies. Public education. Raising awareness about the dangers of fentanyl and how to recognize and respond to overdoses is critical. Public health campaigns can educate communities on safe prescribing practices, the risks of illicit drug use, and the availability of naloxone. Policy measures. Government policies can play a significant role in prevention. These may include regulating prescription practices, implementing guidelines to reduce overprescribing of opioids, controlling illicit supply, strengthening efforts to intercept illicit fentanyl and its analogs, funding for treatment programs, increasing funding for addiction treatment and recovery services. Harm reduction strategies. Harm reduction approaches aim to minimize the negative consequences of drug use. These include needle exchange programs, providing clean needles to reduce the risk of infections. Supervised injection sites, safe spaces where individuals can use drugs under medical supervision, reducing the risk of overdose. Naloxone distribution, making naloxone widely available to first responders, healthcare providers, and at-risk individuals. Ongoing efforts and future directions. Addressing the fentanyl crisis requires ongoing efforts from various sectors, including healthcare, law enforcement, and community organizations. Future directions may focus on research, continued research into more effective treatments for opioid addiction and overdose. Technology, development of new technologies for rapid detection of fentanyl and its analogs. Policy innovation, innovative policy approaches to balance the need for pain management with the risks of opioid misuse. Community engagement, strengthening community-based initiatives to support individuals in recovery and prevent substance abuse. In conclusion, Fentanyl poisoning is a critical public health issue that demands comprehensive understanding and action. Its potency and widespread availability in the illicit drug market have led to a dramatic increase in overdose deaths. Addressing this crisis requires a multi-pronged approach, including public education, policy measures, harm reduction strategies, and ongoing research. By raising awareness, improving access to treatment, and implementing effective prevention strategies, we can reduce the impact of fentanyl poisoning and save lives. Thank you for watching. Please subscribe, like, and share.